Q&A. We need that. So should I go ahead and start?
Yeah, sure.
Okay.
Yep. Okay.
All right, we're recording.
Okay. So pull out your O'Brien blueprint on Blackboard. And before I start, I was thinking of some strategies last night. And so with this information being given to you today, if I were to approach this exam, this is how I would study. Today is Wednesday. I would take today off. Just sleep, do something fun, sleep as much as you can to get yourself refreshed. And then I would start studying on Thursday. So if you start studying on Thursday, that gives you 4 days. So Thursday, Friday, Saturday, Sunday. And there are 65 questions on this exam. What I would do is divide it amongst those 4 days. So I would make myself a goal of looking at 16 test questions a day or 16 items. And we're going to give you the items. If you notice on the blueprint, they're numbered like 1, 2, 3, 4. Those are literal, that's a test question. So number 1 is a test question. Number 2 is a test question, etc. So I would look at 16, roughly around 16 a day. And if you have a bad day or a busy day, then just add 8 to one day, 8 to another day. So it's going to be really important that you stay, you've got a goal and you work on it a little bit every day so that it doesn't become overwhelming. And when you think about 16 a day, some of those questions are math problems, math. So you don't really, unless you're struggling with math, you can just kind of knock those out of your mind. And then another positive thing is that 12 of these questions are renal. And so you should be really strong in renal now because we just took the renal exam. So I would do the renal questions last. I would avoid those until the end. What I would start with if I were you is GI. I think that was what we did in the very beginning of the semester. And that's probably where you are most rusty in your GI. So I'd start there. So those are my tips on how I would handle this so that it doesn't become overwhelming. And after you've done 16, treat yourself, take a break, stop, don't keep going, just, little chunks, small chunks.
Just a quick question before we start.
Yes.
Is our Medsurge exam Monday or Wednesday?
It's Monday, I believe. Is that right, Penny?
Yeah, Monday. Your mental health is Wednesday.
Okay, thank you.
Mm-hmm.
You're welcome. Yep. Okay, so let's start with question number 1 on the O'Brien blueprint. Of course, sorry, dog. We have, this is a question from chapter 52. 52, and this is a question about EGD, a post-op care question. So your patient has had an EGD, and after the EGD, what would you monitor the patient for? So anesthesia is going to depress the gag reflex. So what we want to watch that patient for and monitor that patient for after an EGD? I think Monica might be. Okay, I got her. I think it was Monica. Okay, so EGD post-op care. That's question number 1. Question number 2, colonoscopy post-op care. So after a colonoscopy, what would you tell the patient is to be expected? What is normal after a colonoscopy? And then what would you consider to be abnormal as a nurse? First, as a nurse, when you're recovering the patient, and second, when the patient goes home, you're going to have to do patient education. So what would you tell the patient to continue to watch for and to continue to report after you're done watching that patient? So that's post-op colonoscopy care, and that's from chapter 52. Question number 3 is an airway question. So if your patient has an oral tumor, you want to think about airway, maintaining airway. You want a patent airway. Question number 4 is a question about screening for oral cancer. So this is chapter 53. So what are the risk factors for oral cancer? And of course, alcohol is one. Alcohol is every condition. It's a risk factor for everything. Okay, so what are your risk factors? Question number 5, NG tube care. And this, if you passed your check off, the answer to this question. So review your check off paper, read about it in that chapter 54, but this. Question number 6 is esophageal dilation. So why would your patient need esophageal dilation? Some examples would be possibly an esophageal stricture, if they have impaired swallowing, possibly from a tumor, they may be a candidate for esophageal dilation. So, why would your patient have this? Question number 7 is a question about gastric cancer. And this is a select all that apply. What are your risk factors for gastric cancer? And I'm looking for conditions such as H. pylori is a risk factor. Also, I'm looking for diet. So what kind of diet would your patient would put them at risk for gastric cancer? Okay, question number 8 is H. pylori. And again, H. pylori is a risk puts your patient at risk for gastric cancer. So what is the treatment for H. pylori? And that involves extensive drug therapy. So how would you educate your patient? And it's going to be difficult. It could be difficult for some patients to be compliant. So what would you include in your patient education? And then just be aware, you want to really make sure that they're able to be compliant with the drug therapy for H. pylori. Question number 9 is an NG tube. Again, insertion of NG tube. This is a select all that apply. This. So if you've passed check off, this. Question 10 is a bowel obstruction question. So with a bowel obstruction, if your patient is recovering from a bowel obstruction, or they are at risk for a bowel obstruction, or you suspect a bowel obstruction, the priority assessment is going to be listen to the abdominal sounds. So do a good assessment. So abdominal sounds. And question number 11 is an ileostomy care question. So stoma. Remember your stoma care, colostomy, ileostomy. Think back to your simulation. Remember your patient had a colostomy and the daughter visited and you did patient education, you did an assessment of the stoma. What do you want to see? What does a healthy stoma look like? What does an unhealthy stoma look like? Okay, then question number 12 is a malabsorption question. So patients can suffer from malabsorption, malnutrition in the hospital setting, and some reasons, this is a select all that apply, and I'll give you a couple reasons. Number 1, it's from things that we do to them. So we make them NPO, so they suffer from malnutrition because of their NPO status. Another example would be cultural preferences, for example. So the food that we serve them in the hospital, I see patients, family members bring in all kinds of horrible food when they're in with chest pain. And, it's like, ugh. We might even do that to our loved ones. We might bring them goodies, sweets, because we feel bad, they're sick and we want to make them feel better. So there are a lot of cultural concerns there. And hospital food's not the best, doesn't taste good. So they are at risk. Those are two examples. There are more. This is a select all that apply. Number 13, I want you to study lactulose. And I believe you know this. So if your patient is prescribed lactulose, what will we tell them? How will we encourage them? We want you to have diarrhea because why? So lactulose. Question number 14 is a hepatitis A question. And this is another patient education question. So maybe they are diagnosed with hepatitis A. What would you tell them? How would you educate them? Question 15 is acute cholecystitis, and this is a select all that applies. And let me find my notes. Sorry. Okay, this is a signs and symptoms of acute cholecystitis, and this is a select all that apply. Signs and symptoms of acute cholecystitis. Then question number 16 is a lap chole question. And you want to know what type of post-op teaching that you will do for your patient who has had a lap chole. Number 17 is just Foley cath care. And you know this. You probably know this from foundations. So just review your indwelling catheter care. 18, renal. Renal is our UTI in older adult. So what are the signs? What are we going to monitor for? And remember that our older adult does not always show a fever. They won't have a fever. So we need to look for other more specific signs and symptoms. And you can review your outline, and we just tested on this, so I think that you'll know this answer. Number 19 is renal stone prevention. How can we prevent stones? Number 20 is medications used to treat urinary incontinence. And this is a select all that applies, and you have a chart and a page number that you can study. And you've seen this probably today. Some of this information you've seen today. Question 21 is acute pyelonephritis. How can we prevent this? And then, look at your outline. Question 22 is renal. So with renal, hypertension can lead to end-stage renal disease. And I want you to think about the different populations, different cultures that are more at risk for hypertension. So for example, the African American population, they have a higher rate of hypertension. So they may be more at risk for hypertension. Also, that would lead to our renal disease. So we would want to, be aware of that with that population. Question 23 is another renal question, and this is a nephrostomy tube care question. And you know this, you've studied this for the exam, so you've seen some of this already today, so you should know this. And there's two of them. So question number 23 is nephrostomy tube care, and question number 24 is nephrostomy tube care. And once again, you know this, and this information is on your outline. Question number 25, acute kidney injury. And this is chapter 68. And let me find my notes on what I want. I want you to know the causes of acute kidney injury. And this is listed on your outline. It's listed on the longer outline. So not the summary, but that longer outline has a whole lot of information about acute kidney injury that I'd like you to study. And you need to remember that one of the causes, or a decrease in perfusion will lead to acute kidney injury. Decrease in perfusion leads to acute kidney injury. So what conditions cause decreased perfusion? So think about along that line. And question number 26, chronic kidney disease. Both 26 and 27 are both chronic kidney disease. And remember that we want to maintain a fluid balance with chronic kidney disease. And so if they are at risk for an imbalance, And if we have fluid overload, we want to think about pulmonary edema. How will we prevent that? How will we notice that? So the number one red flag for fluid overload, that would lead to pulmonary edema is going to be, you need to listen to the lung sounds. So the first thing, if you suspect it, grab your stethoscope and listen to that patient's lungs. And that's usually where it starts. And then they're diagnosed later with fluid overload. So listen to the lungs. And then we want a balanced intake and output. And I know as nurses, to me, it's felt this way for years, that here I am charting my intake and output every shift. No one ever seems to look at it. No one seems to care. I want to tell you that physicians do look at that. Maybe not every physician, but your good physicians are going to look at that intake and output, and they're going to question you about that. So in the critical care unit, especially, they're looking very closely at that. I've had physicians ask me, I haven't had time to enter my intake and output, and I've had them ask me, hey, what was your INO this shift? So they'll approach you and they'll ask you. So we want to maintain a balanced INO. And okay. And then number 28, another chronic kidney question. And so remember that our chronic kidney disease patient is at risk for metabolic acidosis. So you want to study that same image, that metabolic acidosis image that we looked at with DKA. So that one picture is going to apply to both your DKA patient and then also your chronic kidney disease patient. And so metabolic acidosis, remember that Kussmaul respirations are on that document. So, be looking for that in both of those patients. Kussmaul respirations are not just for the DKA patient. It can also be a renal patient. And the body's just trying to compensate, trying to get rid of the carbon dioxide. Okay. Question number 29, our older adult. I've already kind of mentioned that. This is from chapter 17. Remember that they don't always show the typical signs and symptoms of infection. So what are we going to look for? Look at your outline. I think we're all well aware of this from COVID. Many of it, we're talking about the older adult not having a fever, but I think many of you don't have fevers. We're all registering like 96s and 97s. So, that's not always the sign that there's an infection. And remember that with the older adult, that can be missed, and then they can be septic before you know it. Number 30 is a question about acute rejection. So study acute rejection. That is also, and this is in relationship to transplants. And this is in your chapter 17. Remember that, one of our signs is abnormal labs. So abnormal labs associated with that organ. So abnormal labs for that kidney, for example. So you want to know your normal BUN and creatinine. And then question 31, we've got an RA versus OA question. You need to study your signs and symptoms, your systemic signs and symptoms of RA, rheumatoid arthritis. And this is a select all that applies. So how will your patient manifest? And I'll give you two of them. There are more. Two examples would be anorexia and fatigue. And there are more. So that's a select all that apply. And then the last one, number 32, is osteoporosis. And I want you to study the dietary factors related to osteoporosis. So what kind of dietary habits can contribute to the development of osteoporosis? And some examples, surprise, surprise, alcohol is one. Alcohol and carbonated beverages is one. Kind of different, and there's more. This is a select all that applies, but there's two for you. And let me scroll through my notes and make sure I said everything. Okay, gallbladder. I don't know how I missed this, so let me throw this in. Gallbladder. Study the diet, the recommended diet for a patient that has gallbladder disease. Gallbladder, what types of foods should they avoid? Alcohol is a risk for oral cancer. I think I said that. Okay, I think that's all.
Okay, you guys, I'm gonna go next. So pull up Roberts, and I'm gonna actually share my screen just because that way we can look at it together.
Professor O'Brien, real quick, could you run through and tell us again which ones were select all that applies? Because I know you said out loud some that weren't on the printout.
Let me, yes. While Penny's talking, let me kind of go over my notes so I can, and then I'll verbally mention it towards the end. Okay.
Okay, does that work then? Okay. There's one question, Professor O'Brien. Is the question, is the gallbladder stuff for a specific question? Does it tie to a certain specific question?
Yes. Yeah, it's a question and I don't see it on the actual outline. So just add that to your notes. Just study the dietary recommendations for someone who has gallbladder disease.
All right. Well, let's see if it'll share if I have to go back and get it. Well, I have to go back and get it, you guys, just a sec. Okay, I'm going to be having to post my select all that applies because I don't have that delineated out yet. So I will do that in an announcement and I'll tell you to which question and whatnot, okay? All right, so we're gonna have our very first question is gonna be about insulin and I have the focus there is safety. So I want you to be thinking about all the stuff we talked about in lab and in the lecture. There's lots of safety stuff like labels, reading labels. There's things about using the right syringe. There's understanding that mils are not the same thing as units, right? Those are the kinds of safety things I'm after. For hypoglycemia, you can see I want the signs and symptoms of hypoglycemia and treatment at home and at the hospital. So table 64-12 and table 64-12 and chart 64-7 has information about the signs and symptoms and the treatment, okay? So remember, looking at things for treatment of hypoglycemia, we have to make sure that when we're doing our patient education, that our families understand if the patient's unconscious, we don't put anything in their mouth. All right. DKA versus the hyperosmolar hyperglycemic state. I want you to know the difference between the two and the treatment for both. Okay, so manifestations and labs. And so all of that kind of ties together with how do we treat that? Remember, we're watching the sugar closely because if they're in DKA, we need to start insulin and we'll at a certain point with the sugar, we add dextrose back into the fluids and we're watching the potassium. And at a certain point, we start adding potassium back in. Hyperosmolar or HHS, remember we start with fluids, okay? So fluids is how we are hoping to correct the sugar. Okay, so there's reading 1313 to 1360 for the treatment component, okay? And the table 64-13 compares the two. Okay, so for self-management and what to do to prevent chronic complications. Okay, so what are we going to teach them? How to prevent it and manage it. So there's lots and lots of stuff with this. The things I'm looking for are, as far as prevention, remember we used either tight or good glycemic control. For other self-management kinds of things, there's sick day rules, there's foot care, and things like that. So how are we going to teach them to do that? And so I didn't put any of those other tables and stuff. So I would eyeball those, but I would think about what's most important to prevent. Okay. All right. SIADH. I want you to know the manifestations and what electrolyte imbalances it can cause. And then what might you do from pharmacological standpoint and then a non-pharmacological standpoint. So you need to know if the SIADH person has overload or is dehydrated, okay? So, and plan accordingly. So I'm gonna let you look that up. It's pages 1251 to 1252 if you don't remember, okay? Hyperthyroidism. So the clinical manifestations, take a look at those. Those are in chart 63-1. Remember the labs, what are the relationship between T3, T4, and TSH? And then for surgical interventions and non-surgical interventions, one of the things I want you to be thinking about with surgical interventions are two big things. Anytime we manipulate the thyroid, we're at risk for thyroid storm, okay? And also, whenever we manipulate the thyroid, we're at risk for damaging those parathyroid hormones. And that manifests as hypocalcemia. So what are those things that we need to be watching for related to hypocalcemia? Okay. So you can read about that on 1269, and there's a critical rescue on 1270 for you to take a look at. For hypothyroid, the manifestations are in chart 63-3. The labs, same thing. What happens to the T3, T4, and the TSH? And remember, those are inverse, that relationship. What are some of the complications? And then the treatments. So look at chart 63-7 for the complication of myxedema coma, okay? All right. Moving on, Cushing's. Now, I'm pretty sure this one's a select all that apply, but I swear I will verify with you. So what are those key features that we see? Okay, so what are some of those things we talked about? And remember, those can be physical manifestations. They can also be related to electrolyte imbalances. Okay, so when we're thinking about that, we have to consider both aldosterone and cortisol. Okay, key features are listed in our chart 62-10. Okay. There will be 2 questions on seizures. Okay, so that's the same component for your description, excuse me, is the same for both of those. So it'll be something within those for both of those questions. Okay, so remember seizure precautions, our management, what do we do when they're seizing, what meds do we give to stop our seizures, those kinds of things, and then what do we document? So there's some charts there for you, and then 878 to 879 is focused on the management. Guillain-Barré, I don't know if that's how you say it. GBS, so know those manifestations, okay, and that's on page 869. And then our nursing priority interventions, one of the charts I want you to look at is 42-5, okay? And along with our manifestations and our priority interventions, one of the things I want you to be thinking about is aspiration, okay? And there's an action alert on inbox or on page 1081, and it's not one of our chapters, I don't think, or it's not within my chapters, but go to that. That's great for aspiration risk. Alzheimer's, there'll be 2 questions on that. And so what are some of the key features that got your chart listed right there? And then what are the appropriate interventions for the level of dementia? Okay, so we talked about we orient early and then we use something called validation therapy later. So that's all on page 863. There is a chart 42-2 that talks about how to promote communication with our patients with Alzheimer's. And then remember, there's a slide in your PowerPoint of chapter 42, slide 13, that talks about, remember, we have to do a lot of testing, a lot of lab testing to rule out other causes for confusion. So, right, we've already talked today already about confusion with infection. So if it's somebody with new confusion, we might need to do a UTI or blood cultures, make sure they don't have an infection. Okay, so what are all those things that could cause confusion? Remember, hyponatremia can cause confusion, et cetera, et cetera. Okay. For HIV, I want you to know there were categories and what is needed for a diagnosis of AIDS. What's the diagnosis for AIDS? So it's an opportunistic infection plus a certain level of the CD4 T cells. Know what that is. I want you to know the priority problems, such as diarrhea is a big one, right? There's cognitive changes, and then the HIPAA concerns with our patients with HIV. Okay? We need to make sure that we protect their privacy. For allergic reactions, I want you to know the key features of anaphylaxis, and that is in chart 20-2, right? And on our actual, or on the test that we did that with, remember there's a picture of the angioedema, okay? So remember that's part of that as the anaphylaxis progresses. And then what's the priority care? And that's in chart 20-3. And remember, why do people die from anaphylaxis, right? We don't give them their epi fast enough. So I want you to be remembering that. I'm going to be reviewing the math with you guys. Monica and Sarah, jump in if I'm missing something. So you're going to have 2 drop factors. 17 and 18 are both drop factors. Our advanced calculation means the conversions, right? Micrograms to milligrams and kilograms or pounds to kilograms, etc. Okay. And then we'll have a general calculation for IV med and 2 for PO. Okay. Remember that labels are also important. That's part of your checks, okay, when you're giving medications. All right. I'm going to stop sharing. Okay.
I threw my select all that applies in the chat.
Great.
So I double checked. 20, or I can't even read. 31, 32, 15, 12, 7, 9, and 20. So 31, 32, 15, 12, 7, 9, and 20. And Maggie, I forgot to look at the chat. Did you get your question answered? I see. What question is that for?
That's for me.
Oh,
Totally
sure.
skipped it. Thanks, Maggie.
Okay.
So DI, sorry, you guys, DI is 16 on my outline. Okay, so again, with that, kind of like with SIADH, it's going to be know the manifestations, the fluid and electrolyte imbalances, non-pharmacological and pharmacological interventions. So remember those non-pharmacological ones, when we have all those fluid shifts, we either need to be doing a fluid restriction or making sure that they always have some fluid within reach. Okay, so go back and review that. Thanks. Yes, and good, thank you. We just answered the HESI question. All right. Professor O'Brien.
Any other questions for me? I'm sorry. I always forget to check the chat.
It looks like it's okay.
Okay.
I mean, we'll have Q&A after this too, though, right? I mean, once we go through it, we'll also allow for questions, is how I understand it. Okay.
I don't know if Monica wants
Yep.
to go.
I'm going to
Okay.
share my screen too. Okay, so you have the blueprint, and this is the smallest section. There'll be a question on ICP, increased intracranial pressure. So make sure you just are going over what those signs and symptoms are. And again, early versus late signs. So think about that when you're looking at that information. Question about CVAs. So look at chart 45-4. That's the one that talks about the right versus the left hemisphere CVAs and kind of what you see there. And also think about your nursing care when you have someone that comes in with a stroke on that. 3 actually was already covered. That was actually on Professor Roberts. So that's a duplicate. Just skip over that one. She had her information and stuff attached to that. Number 4 was spinal cord injuries. There's going to be 2 questions on that. I want you to review your information about the autonomic dysreflexia and how that presents. Hang on just a second. So with your spinal cord injury, go over your autonomic dysreflexia and how we're going to treat that, what we need to intervene and do. Then for the number 5, for immobilized patients, psychological considerations, think about those patients with those spinal cord injuries and the changes that have occurred and how that is emotionally going to affect them. Think about, you know, what kind of support they need at home, how it's going to change their ADLs and functioning, family type stuff. So consider all that information. Number 6 is on radiation therapy. So I want you to review the difference between your teletherapy and your brachytherapy. And then your radiation precautions. So that's what I want you to think about there. So again, a couple of charts for you, chart 22-1 and chart 22-2 to look at those. Oncological emergencies, number 7, I want you to think about tumor lysis syndrome, the superior vena cava syndrome, sepsis, and DIC. And if you go to the chapter 22 PowerPoint slides, if you go to the chapter 22 PowerPoint slides, focus on slides 24 through 27. And actually, if you want to star number 7 and put that there's going to be 2 questions related to those emergencies. Okay, so there'll be 2 questions related to those emergencies. And you don't need to go into great detail, but just there's a good slide on the tumor lysis syndrome. So review that, what's happening. And the other ones just know generally what they are and what is it that we have to do to solve that. So if we're thinking, for example, about the superior vena cava syndrome, that is usually a tumor that's putting pressure and compressing that superior vena cava. So obviously we're needing to remove that to return the blood supply to normal, or, so that's what I want you thinking about. Just those generalized things of what is it, what's causing it, how do we need to fix it. Number 8, musculoskeletal trauma. So again, I want you to look at chart 51-3. What are you assessing for? Your neurovascular assessment when you have patients with a fracture. So what is it that we're assessing? How are we assessing that? Remember that we compare extremities, one side to the other on that. Second question, I want you to look at chart 51-2 and chart 32-3. And that's just so you can compare the PE versus fat embolisms. Fat embolisms are a complication we get with fractures. But just take a minute to look at those, because a PE and a fat embolism look very much alike in how they present. It's the difference comes in just what has caused it. A PE is an actual blood clot in the lungs, whereas a fat embolism is those fat globules that have released when you have fractures, especially of your pelvis is a huge one, and long bones. But pelvis is the most common. But again, it's that release of those fat globules into the bloodstream, and those are what are traveling, causing those blockages. So just look at that. Osteoporosis, I think that might have doubled up with one that Professor O'Brien talked about. So that's probably an overlapping one. And then musculoskeletal trauma, the last one, I want you to look at compartment syndrome again, and the signs and the symptoms. What is it that they need to be reporting immediately to the physician that we want to teach them? What were the teaching things? So that's chapter 51, PowerPoint slide 7. There's a critical rescue box on 1044 for you to look at. But there again, know what compartment syndrome is, what are the signs and symptoms, and what is it we need to report early. So remember, when you're having pain that is uncontrolled with medication, pain that is worse than the original injury pain, that's a big red flag that something's not right in that area. So, and remember that compartment syndrome can be either from an internal source or an external source. So remember that when you're kind of going over that and looking at that. And there'll be 2 questions related to compartment syndrome. So star number 11. Because I think 2 of mine were actually duplicate with somebody else's. So. All right.
So just regarding the grade book, you guys, we will have the HESI grades in, plus we'll have the lowest quiz grade dropped, and all of the appropriate grades pushed, so you know what your points are going into the final. So we will get that done, by this weekend, okay? Hopefully Friday, but this weekend. Oh, the math test that you guys took, the 3 attempt one, that's a pass fail. You're welcome.